It appears that the guidelines for high blood pressure management are being revised to take a person's overall cardiovascular risk into account rather than just looking at the numbers.
It's about time. That
Well,
means,
you do that anyway, don't
of course,
you?
it's individualized care. Are any two people the same? Should we treat them all with one-size-fits-all strategies? So that's what we were doing. We're making sure that if the blood pressure was above a certain number, that we'd start treating with certain protocols. And now, finally, some sense has come into what we do, how we manage these people, and it's about time.
And the American Heart Association Scientific Sessions report showed that blood pressure treatment, just focusing on the blood pressure readings, leaves substantial cardiovascular disease risk unaddressed.
Exactly. So it's time to start paying attention to who's the patient. Do they smoke? They got type 2 diabetes? Are they overweight? Are they under a lot of stress? Are they not sleeping well? Maybe those just have a little something to do with when to do what.
And maybe their diet, too.
Oh, absolutely. Absolutely.
So, in other words, doctors need to look at the whole person, including their risk factors for a heart attack and a stroke, and their lifestyle, before treating the hypertension and balancing the side effects of treatment along with the benefits.
Right. We tend to get into this mindset where there are certain guidelines. If your blood pressure is over 140 or over 90 on the bottom, we have to start treatment of some type. Now, a few months ago, they came out with the idea that for people over the age of 60, everybody who has a blood pressure of 150 or 90 or less shouldn't be treated. And it's like one size fits all. And where's the individuality? Where do we get a way of trying to look at each person and find out what's their actual risk for having one of the complications of hypertension, rather than just categorically treating them and put them at risk for all the side effects?
Well, right, because a patient isn't just a number anyway.
No.
They're an individual. And when you start just giving drugs to everybody, people have side effects from these drugs.
Oh,
I know a lot of people that are on blood pressure medication and they're just tired all the time. They feel weak. They feel lightheaded.
Sure.
They have to pee all the time.
Well, I mean, for people over the age of 60, 2/3 have hypertension. And for people under the age of 60, 1/3 do. And so, because everybody's different, first we should make sure they in fact have hypertension, because maybe what they have is just white coat syndrome.
That's true.
Come into
too.
the office, you take their blood pressure.
They're nervous.
Sure, and maybe they've been waiting and they're a little hacked off.
Or they've been rushing to get there.
Exactly. So there are a lot of factors that go into looking at every single person and how their whole life story fits into the diagnosis that you're entertaining.
Well, this approach too will help the people that are most likely to benefit.
Oh, I think so too. I mean, it's like cholesterol. We're finally waking up the fact that not everybody with an elevated cholesterol needs a statin. And in fact, they use this example in this particular article, saying that some people who have high cholesterol and don't have any symptoms or any diseases associated with it, fine, leave them alone and do lifestyle things as the first thing. For those people who smoke and have had a heart attack or a stroke, maybe they have type 2 diabetes, you might be a little bit more aggressive, because you know that the target organs that are being affected by hypertension can be lethal.
So I think, could talk a little bit about what to do if somebody has high blood pressure to manage it without the drugs.
Oh, I think that lifestyle is the most powerful medicine we have. So if you eat right, you manage stress, you exercise regularly, you weigh what you should, you avoid environmental toxic exposures, and you have a meaningful purpose in your life that brings you joy, you're going to do very well. And most of us don't have all that right, because we depend on our doctors or on those direct-to-consumer ads that we're looking at when we watch television that tell us, don't worry, if you don't take care of yourself, we can take care of you.
So just pop a pill.
Exactly. And they don't, well, they do tell you about the side effects, but if you listen to those, you'd almost have to be crazy to be thinking about trying some of the drugs that are recommended for some health conditions.
There's a lot of crazy people out there.
Well, we get lazy and we get convinced by these ads and by the whole philosophy of a sick care system. We don't have a health care system. We have a sick care system. And that uses drugs, surgeries, and technologies rather than going back and taking personal responsibility yourself for your health. So when we're looking at hypertension, just like every other situation, we're looking at different illnesses, we need to pay attention to who the person is, where the best strategies are. And then if you tried all those, it might be time to be thinking about using a medication, and maybe not the same medication for every person.